So the Health Minister, Dr. Zweli Mkhize, just speaking there, saying that indeed we have enough vaccines for the 40 million people that need to have it this year. And of course, that's very positive. The finer details are going to be announced to the nation in due course. So we really are on track in terms of getting that herd immunity, for South Africa to get under control this COVID-19 vaccine.
Absolutely. Very profound and reassuring words from Minister Mkhize and President Ramaphosa. And in time, it does look like we will be able to achieve the herd immunity that we all long for. But we must realize that today is a significant milestone. We can look at this with great national pride, and definitely that our healthcare workers will get the protection that they so richly deserve. This is a real great milestone. They've witnessed immense suffering, and really this brings much reassurance. But we must recognize that this will take time. So there is a light at the end of the tunnel, but there is still a long way to go before we can effectively curb the spread of transmission of COVID. So we need to continue to adhere to the non-pharmaceutical interventions and continue with all the behavior modifications that we as a country have adopted over the past few months.
What is your feeling about the Health Minister, Dr. Zweli Mkhize, and the President, Cyril Ramaphosa, having their inoculations right away? What signal do you think that should send to South Africans?
So the Minister and the President had a special application in order to get the vaccination, and they're essentially key stakeholders. And by them having the vaccination, they're providing reassurance and trust to the public that this is indeed something that we should all take confidence in, and that, they're providing correct messaging so that they're reassuring the public that we should all take the vaccine when our turn eventually comes, and really just supporting the public as we move through this period of uncertainty and anxiety.
Yes.
As key stakeholders, they have received the vaccination in order to send this message to the public and reassure the public.
Just take us into the details of the Johnson & Johnson vaccine. We do understand that a study showed that for mild to moderate ailments, its efficaciousness is about 57%, but for more serious illness, it's about 85%. Just break down what that actually means, and also give us a sense of what some of the after effects may be, the side effects may be after you've been immunized.
So if we talk about the Johnson & Johnson vaccine, so we'll remember that in South Africa, we discovered a new variant recently known as the 501YV2 variant. And it was discovered that the AstraZeneca vaccine, which we had originally planned to roll out, was not preventing against mild and moderate disease due to this newer variant. Whether it protects against severe disease is yet to be known, and this is being investigated. However, we know that the Johnson & Johnson trial took place over several countries in the world, including South Africa, and it did show efficacy against the new 501YV2 variant. And what is really reassuring is that evidence showed that there was 85% efficacy against severe disease. So that is really a high level of efficacy that is protecting people against severe COVID, and 100% efficacy against death. So this is critical in terms of preventing severe disease and the effects on our health system as well. It has lower protection against mild to moderate disease, but nonetheless, it is still far more than the AstraZeneca vaccine, which was also trialed in South Africa during the time of the new variant's dominance.
Yes.
So it's really reassurance, and we can be really reassured by the 85% protection against severe disease and 100% protection against death. In terms of side effects, so all vaccines may have side effects, but usually these side effects are mild and not dangerous. So we can be reassured there as well. And I often tell patients that, the actually having side effects is one indication that the vaccine is actually working and doing its job in your body. And these are usually very mild, for example, a sore arm, perhaps some chills, and they usually resolve quite quickly and are not dangerous.
And just in terms of what you were saying about us continuing to proceed with wearing masks and doing all the other safety protocols. So now the President and the Health Minister have had their jabs. So presumably they should continue wearing their masks, etc., etc. They can't just carry on as normal.
Absolutely. So we must remember, first of all, that there will still be some time before the vaccination takes effect for them as individuals. But nonetheless, we still need to continue, despite having the vaccination, we also need to curtail the spread of the disease from person to person. And for this, those non-pharmaceutical interventions are critical. So despite getting the vaccination, it's certainly a sign of hope. But we do need to get to that level of herd immunity before we can actually stop or consider changes to our behavior modifications that we've all adopted over the past few months.
Thank you very much, Dr. Nisha Jacobs.